Hi, my name is Shelley Leffingwell, and today we're going to talk about tuberculosis. To be or not to be? That really is the question. The purpose of my speech is to actually explain to you the different types of drug therapies and programs there are for tuberculosis. What types are there? I also want to stress to you the importance of why you should be tested for tuberculosis. Every year, over 1.5 million people worldwide die from tuberculosis. Approximately 10,000 cases per year are in the United States. Of those cases, 1/3 of them will pass away from tuberculosis. There are 3 types of tuberculosis. There's latent, there's TB, the disease, and then there's drug-resistant tuberculosis as well. Latent tuberculosis is one where the host does not appear sick, and may not have any signs or symptoms, and they are not contagious at this point. TB, the disease, which is caused by a bacteria, is highly contagious. They appear sick and very well could pass that on to you in a very short amount of time. Drug-resistant tuberculosis is the type where we have tried a course of drugs with you, therapy to take care of that TB, and it didn't go well for a variety of reasons, and we'll talk about those reasons later on. Things you should know: tuberculosis can attack the nose, the brain, the spine, and the kidneys. So it doesn't just attack the lungs. We normally see it in the lungs, and that's where we will tell you about it the most, but that's possibly, there are other areas that it will affect as well. How do you get it? You get it from speaking, coughing, sneezing, singing, laughing, anything that is airborne. So anything that's going to have a little bit of air droplets coming out of your mouth is the option for getting tuberculosis. What are your signs and symptoms? Well, you have a bad cough that lasts longer than 3 weeks or longer. Chest in your pain in your chest, wow. Coughing up blood or sputum, weakness or fatigue, weight loss, no appetite, chills, fever, sweating at night. Sounds like the flu, right? Well, the difference is this is caused by a bacteria. The flu is a virus. And the only way to find out the difference is you're going to have to go to the doctor. If you don't recover from your flu and it keeps going on for more than a week, I would definitely have it checked out by someone for you. What are your risk factors to get TB? Well, HIV, being positive, will definitely increase your risk factor because your immune system's already suppressed. Recently been infected with tuberculosis, like within the last 2 years, you are a more likely candidate for it to come back stronger. You have some other health problems, such as diabetes. Again, suppresses your immune system. Your body doesn't deal with it well. Abuse illegal drugs or alcohol. Again, the immune system takes a beating when we do things that we shouldn't with our bodies. Or if you've had TB before and you did not test or follow the course of treatment, because it is a lengthy process, and we're going to talk about that in a little bit. There are 2 types of testing for tuberculosis. You have a skin manto test, which we've all seen, where they shoot the little needle in and it shoots some drugs in there, some bacteria in there, and then in 24 to 48 hours they're going to have you come back and they're going to read it. The nurse looks at it and goes, "Oh, you got a little pimple like Dot. Time for you to go have a blood test or an x-ray." If you don't get a pimple like Dot, you're good to go. You're safe. If you have to be sent off to get a blood test or an x-ray, we're looking for the chest to make sure that it's clear. As you can see from our slide, that the manto test will definitely rise up and your skin will get bigger. It's not very pretty. Well, your drug treatments take anywhere from 9 months to 3 months, depending on how long, what types of drugs we give you. Most drug therapies are twofold. One of them would take an initial 8 weeks, and then we're going to lower the dosage down and continue on that drug therapy for another 18 weeks. If that doesn't work well, or you're not responding well, or you have an adverse reaction to one of them, we're actually going to give you a drug that is very similar to an anti-cancer drug that takes up to 18 weeks, and it's twice a week, and not very fun. So there are 2 phases. You have an initial phase for the drug as well as a continuation phase. The initial phase is we're going to hit you high every single day with these 2 drugs, And then we're going to go into a continuation phase where we lower that dosage and keep going for another 8 weeks or 18 weeks. Yikes, I'm not so sure I want to be committed that long for bacteria. What makes you drug resistant? We talked about that a little bit earlier. If you didn't take your TB drugs regularly like you were prescribed, you didn't finish the course for whatever reason, you developed the disease again after being treated in the past, you're coming from an area where TB is known to be common, or the drug-resistant form of TB is known to be common, or have spent time with someone who is known to have drug-resistant tuberculosis as well. Some things to think about when we're looking for TB in the lungs. We're looking at little capsules. In these little capsules, the alveoli will start to burst. And as the alveoli burst and the disease comes along, you're going to get a bigger pocket and a bigger pocket and a bigger pocket to where that's why you look like you have a smoker's lung, which isn't very fun. So as you can tell, having some tuberculosis in your life, I wouldn't suggest it. Make sure that you get tested regularly, especially if you're working in a nursing home or if you're working in a school system where you have lots of people in a small controlled area. Thank you and have a great day.